Have you ever looked at your supplement and wondered, do I actually need vitamin E? Or am I just buying it because people say it's good? You've probably heard vitamin E is good for blood, skin and strength. Take it daily. But here is the question we rarely ask. Do most Nigerians actually need vitamin E supplements? Or are we already meeting our needs from food? Let's look at what the science says, especially in our Nigerian context. In Nigeria, cooking oils like palm oil, groundnut oil and soybean oil are part of everyday meals. Yet, many people still buy high-dose vitamin E capsules without understanding what it does, or when supplementation is actually necessary. So, let's break it down in a simple food-first evidence-aware way. Here is the important part. True vitamin E deficiency is uncommon in the general population, but excessive supplementation, especially in high dose, may pose health risks. So understanding the balance matters. Hi, I'm Olamide. I share evidence-informed food-first nutrition education tailored to everyday Nigerians. Now, what is vitamin E? Vitamin E is a fat-soluble vitamin. Its primary role is antioxidant protection, meaning that it helps protect your cells from damage which is caused by normal body process and oxidative stress. And the recommended intake for adults is about 50 milligrams per day. And while the upper limit is much higher, more is not automatically better. That is, excessive intake of it is very harmful to the health. Vitamin E protects the cell membrane. It supports red blood cell stability, and it also helps maintain nerve and muscle function. It as well assists in cellular repair processes. Vitamin E plays a supportive role. It's not just a magical one. Severe vitamin E deficiency can result to muscle weakness in humans. It can as well result to nerve issues, as well as poor coordination, and as well certain types of anemia. But again, this is rare in healthy individuals, especially those people that eat a healthy diet. And feeling tired alone does not automatically mean you are deficient in vitamin E. So the key is proper assessment matters. Vitamin E from food is safe and beneficial. However, high-dose supplementation, particularly in large high-U amounts, may increase bleeding risks in some individuals. This is especially important if you take aspirin, or you use blood thinners, or you take high-dose fish oil, or you have a clothing concerns. Supplementation in such cases should be medically supervised. Do you know that many common Nigerian foods naturally contain vitamin E, such as palm oil, groundnut oil, soybean oil, sunflower oil, groundnuts and cashews, most especially our homemade egusi soup and our natural leaves like ugu, spinach, bitter leaf, whole grains as well, such as brown rice and guinea corn. If your diet regularly includes these foods, your needs are likely being met. In our typical dietary pattern, deficiency risk in the general population is low, but individuals at higher risk include those with fat malabsorption conditions or extremely restrictive diets. For many Nigerians, unnecessary supplementation may pose more risks than benefits. Vitamin E is important, but more is not better, and food remains the safest primary source. Before adding supplement is worth asking, is there a clear need, or am I already covered by my diet? If this breakdown help you think more critically about supplements, like this video, it supports educational content like this. Share it with someone who buys supplements without understanding the why. Subscribe for evidence-informed food-first nutrition education tailored to everyday Nigerians. And tell me in the comments, have you ever taken vitamin E supplements and were they medically recommended? I would love to know.